how do I expand my child's diet? I discussed earlier how eating a varied, nutritious diet doesn't happen automatically. It is a skill that is learned, similar to learning how to ride your bike or swing a baseball bat or brushing your teeth. And the way to teach that skill is through repeated taste exposures. So food preferences are learned simply by tasting a food repeatedly. The word exposure was a term coined by Robert Zajonc in 1968. He proposed that individuals develop an affection for items that are familiar and a dislike for items that are new or novel. He tested this theory with shapes. So he introduced a series of complex shapes to individuals and then later asked them which shapes they preferred. And sure enough, there was a marked preference for shapes that the individual had previously encountered. He suggested that the same principle applies to food. We like foods that we're familiar with, and we dislike ones that are novel. So tasting a food repeatedly is the entry point into expanding your child's diet. In fact, the more times your child tastes a particular food, the more liked the food becomes. Likewise, the less times your child tastes a particular food, the less liked the food becomes. Research with typical eaters suggests between the ages of 2 and 5, it's shown that as many as 15 to 20 exposures are needed before a food becomes preferred enough that they'll incorporate it into their diet. Certainly with older children, more exposures are needed as eating patterns are well established and more practice is needed to change those habits. In our work, we found that children with more severe food selectivity require 3 or 4 times the amount of practice with the food before it becomes preferred as compared to, say, a typical eater. So if it takes, if it takes 20 exposures for a child to learn to like apple, it can take with some of the kids we help, it can take up to 80 to 100 exposures before apple becomes preferred. As more foods are introduced into your child's diet, less exposures will be needed before the food is preferred. In our work, it is around 12 to 15 foods before a child is open and willing to accept a bite on the first presentation. And despite the effectiveness of taste exposures, most parents stop offering a new food after just a few attempts. Parents often interpret those child's initial dislikes, their grimaces, perhaps their gagging response as disgust, and that this disgust is fixed or unchangeable. And so instead of continuing to present your child with those foods and exposing them to those foods, they just remove them from their diet altogether. So there's no doubt about it, taste exposures work. But what if my child won't actually taste a bite of food? What if I can't get it near their mouth? It's just a vehement refusal. It's almost like a reflex, like, nope, keep it away. So the strategies you learned today are designed to help your child learn how to repeatedly taste foods. And we're not talking large portions or large bites of food. We're just talking about small tastings of food. Because again, we know that the entry point into expanding your child's diet is to practice tasting foods. So before we get into strategies, actually I think before we take a break, I just wanted to quickly comment on what is a behavioral approach to addressing food selectivity. At West Coast Feeding, we are a group of behavior analysts. So our approach or our treatment methodology is based on the principles of applied behavior analysis. We do have a registered holistic nutritionist on our team. This has been a very exciting addition to our team, and she helps us analyze the child's diet, inform and help us select foods to target during intervention, as well as support the family with their meal planning and overall nutrition. And then our job is to introduce those foods to the child and teach the parents on how to maintain that long term. So behavior therapy is the only treatment that has well-documented empirical support. Studies emerged in the 80s, and since then there's been this growing body of literature showing its effectiveness in teaching children how to accept new foods. A good behavior treatment is one in which it's multi-component. So every time in any session, we're using between 10 to 12 strategies at a time. When we talk about multi-component, we mean that we're addressing all features of the problem. So we're using strategies to set the child up for success. We're using strategies to strengthen desired behaviors, and we're using strategies to make sure problem behavior isn't rewarded. Sessions are adult-led. The objective is to get kids eating. Certainly children have input, and there is some give and take in terms of what is the expectation, but our objective is to get children eating. So there is this expectation for behavior change.